I'd like to welcome my fellow team members to a new installment of COVID-19 videos. You'll recall that I was taping these in the early days of the pandemic to keep you all informed. As the curve flattened on COVID-19 cases and viewership decreased, I discontinued them. However, we've had a significant uptick in volume that's stretching our system and our capacity. And you all told me that you appreciated receiving updates using this format. So for the foreseeable future, I thought I'd bring you the latest news that I can find from across our system every Tuesday and Thursday for the next several weeks. So today I want to start with sharing our recent data so that you know our current status across our system. And to do that, I really want to introduce you to one of the key weapons that Baptist has in the fight against COVID-19, and that's our own Chief Medical Informatics Officer, Dr. Jake Lancaster. You know, Dr. Lancaster went to medical school at the University of Mississippi. He did his residency in internal medicine at UAB and got a master's in health administration there as well, and then went on to Vanderbilt and got his master's in clinical informatics. So this is a physician that knows everything there is to know about data. Who better to bring you Baptist's data than Dr. Lancaster? So Dr. Lancaster, welcome.
Thank you. I'm glad to be here and happy to present some of this new data. We've had some interesting developments with what we have available to us over the past couple of months, so I'm excited to share some of those insights.
Yeah, that's terrific. Well, I appreciate you putting this together. I know our team is going to be excited to see what all you have. So tell us, just maybe start. How are we doing as a system from a coronavirus admission standpoint?
Sure. Would you like me to share the PowerPoint and the screen?
Yeah, that'd be great.
Let's do that. So this is a slide that I look at on a daily basis, and we present at multiple meetings across the system, but this is showing our daily inpatient volume for COVID-19 patients that are admitted to the hospital, with the blue bar being those that are admitted to med-surg beds and the orange being those patients that are admitted to the ICU. And as you can see since June, we've really been on a steady uptick across the system. But it doesn't necessarily look the same if you look at each individual market and each individual facility across our system. If we drill down, you can see all different sorts of humps and inclines and declines. But at the moment, across the system, we are seeing a steady uptick in cases, which, as you know, if you follow the news, that's pretty stable for our geographic area.
So almost a tripling, really, it looks like, since the end of June.
Right. We've been focused on our doubling rate early on. And if you remember in New York and some of those other places that were having doubling rates every 5 days almost, ours has never been that bad, but we are, really doubling about every month right now, which is quicker than we were back in March and April.
Yeah. Okay. Got it.
One of the key metrics we follow is the percent positive rate for the patients that are being tested for COVID-19. Early on, March and April and May, these numbers were less than 10%. They have gradually been going up as COVID-19 has become more prevalent in our community. And so this is one thing that we can watch and know once this number starts going down, we'll know we're starting to get a handle on it, and it's becoming less prevalent in our community. So it's one of the things that I definitely recommend showing and keeping a focus on over the next few weeks.
Sounds good.
Our day-to-day lab turnaround time, so how quickly are we getting those COVID-19 labs back, has been something of great importance to us as we have this influx of patients. And as you can see, just a couple of weeks ago, we were taking 176 hours to return that COVID-19 lab test. That has greatly improved over the last few days, and so down to about 33 hours today. A lot of that delay was due to national shortage of reagents, which has improved over these last several days, but that turnaround time is really key and something we need to keep watching on a daily basis.
Yeah, Dr. Lancaster, I want our team to understand that we've done so much testing and want to continue to do more. But we really, we take the specimen, we send it off to commercial labs, and like you said, they've been beholden to these manufacturers who've not been sending the reagents, and it's increased our turnaround time. I'm glad that it's gotten down back into something that's that we can live with in the 24 to 48 hour time frame. I heard some data yesterday that our drive-through testing at Baptist Memphis, for instance, we processed almost 400 people yesterday and through the drive-through lane with an average wait time of around 10 minutes. So that's much more improved over the folks who were waiting, long wait times in those drive-through lines just a couple, 3 weeks ago.
That's great.
Good work from our team.
One of the things we wanted to point out was, so we talked earlier about the percent positive rate. So those patients that are coming in and we're doing a test for COVID-19, what percentage of those are testing positive? And so I said it was around 18% at last check, but that is also including patients that are coming in without symptoms and patients that are coming in with symptoms of COVID-19. So those that are coming in with symptoms of COVID-19, over our entire 6 months of treating this, about 20% of those, 1 in 5, are testing positive for COVID-19. And for those without symptoms at all that may be coming in for something else completely, a surgery or heart attack or something else, about 7% of those are testing positive. One of the things that we get a lot of questions about is, how do our employees do versus the general population? And so one of the things I wanted to highlight was for our employees during that same time period, our asymptomatic positive rate is just 0.31% compared to that 7% for the general population.
Yeah. So what that really says is, doesn't it, that our PPE and protocols are really working to keep folks safe.
I think so. And numerous studies are coming out saying that you're more likely as a healthcare worker to get COVID-19 from somebody that you live with or from the community than from getting it from work. And so I think that is encouraging.
Yeah.
One of the other things I wanted to point out was our asymptomatic positive rate and symptomatic positive rate for a special age group, that 0 to 30-year-old age group. And this is only looking at the past week. The asymptomatic rate across the system is about 15.7%, so double what it is for the general population. And if you look specifically at the Memphis metro area, it's about 27%. So 1 in 4 0 to 30-year-olds that you meet without symptoms of COVID-19 that we're testing are coming back as positive, which is pretty staggering.
Yeah, that really is. And with school starting back here in the next week or so, and colleges, be interesting to see and watch that number.
Mm-hmm. One of the new features that we were able to add recently was getting more of this demographic information out of Epic and being able to track those disparities across time. One of the things that you've heard about in the news is that our Black and African American community has been affected much more than the rest of the community as far as COVID-19 goes, and we definitely see that in our data. So the blue bar is our Black patients over time, and so down at the bottom you can see it starts the week of March 15th and goes all the way by week to this last week. And you can see over time how that has changed, with that gray bar in the middle being our Hispanic population. And as you remember, we've had quite a bump in June, so a lot more Hispanic COVID-19 patients than had previously seen. It's since improved somewhat. And then one of the big things you've also read about in the news is that COVID-19 is affecting the older population much more than the younger population. So if you look at our outpatients, or not outpatients, sorry, all of our patients who have gotten COVID-19 and break it down by age bracket. So on the right, you see the green is that 61 plus, and then it breaks it down by 51 to 60 years old and so on and so forth. You can see that as a whole, we really did have an increase over the last several weeks in that 0 to 30 age group that are testing positive. Early on, it was less than 20% were testing positive, and now it's up to 30% that are being positive for COVID. And then if you look at just those admitted to the hospital, you can see that orange and blue bar just almost disappearing, and that green bar of our 61 plus population really taken over. So the majority of those patients that are admitted to the hospital are in that category, though we have seen an uptick in that 22 to 30 age group over the last couple of weeks, but still not nearing, it's running around 5%.
Yeah, it's interesting.
Some of the questions that we've had is, what are these patients coming in with? Early on, everybody was thinking that they were coming in for shortness of breath and fever and cough, but there were all these other symptoms that were being added to the CDC's list of symptoms we need to watch out for. And so, what percentage of our patients with COVID-19 have each of those symptom categories? As you can see from this chart, those that come to our EDs, the majority are coming in with shortness of breath and fever and cough, though quite a number are coming in with just generalized weakness or abdominal pain and nausea. And altered mental status, about 7% of those total COVID admissions coming in with altered mental status. There was a good article out recently, I think from the American Journal of Geriatrics, that talked about altered mental status as a presenting sign for COVID-19 in the elderly. So something we need to watch out for. And then once they come in, how long do they stay? So the COVID-19 patient does generally have a longer length of stay than our typical patient population. The majority are falling in that 2 to 5 day category, with another large percentage in that 5 to 10 day. And then about 7% of these patients are staying 20 days or more. And then I thought this was very interesting. And all of this data is available in Slicer Dicer within Epic for anybody with access to that to explore. And so I just had some time over the last couple of days to play around a little bit. But one of the things I thought was very interesting was that 65% of our COVID-19 patients have a primary diagnosis of hypertension, and the top 3 diagnoses are hypertension, diabetes, and hyperlipidemia. So definitely those risk factors put you at a higher risk for being admitted with COVID-19. And similarly, kind of to complement that slide, on the left is the BMI range for our COVID-19 patients. You can see 60% of those are in the obese range. And if you compare that to our non-COVID-19 admitted patients, 41% of those are in that obese range. So one of the things that we're often asked is what is the mortality rate looking like for our COVID-19 patients? And so again, breaking that down by those age categories that I showed earlier, that 22 to 30, all the way to that 61 plus, you can see that the majority of the patients that are dying from COVID-19 illness are in that 61 plus category, with only 1 patient in that 22 to 30 category and 0 in that 0 to 21 category. I think one of the things that is hopeful is this next slide, which actually shows our mortality rate by those different age brackets. So that prior slide, it looks like deaths are definitely increasing, but if you look at the rate of death for those different age brackets, it's actually improving as we get better at treating this disease. So back in early May, about 18% of those aged 61 and older were dying of COVID-19. That has dropped dramatically over the last several weeks as we get more and more therapeutics that actually work, down to close to 6%, and most recently under 4%. So a huge improvement over the last several weeks, and that's definitely something to celebrate. Our overall mortality rate got as high as 6%, and that has gone down for each age bracket, which I'm definitely thankful for.
Anything else for us today, Jake?
One of the things I'll just mention is a lot of this data is available within Epic. One of the things we didn't go over is the capacity data. So our ICU capacity and non-ICU capacity is available for everybody in that Pulse COVID-19 dashboard within Epic. And then that other demographic data that I was showing is available in the Slicer Dicer application within Epic. So happy to answer any questions that anybody may have on how to get the access to that and use it if there's interest.
So there's data out there for you to access yourself, and then also I look forward on Tuesdays and Thursdays to bringing you updates on this data as we move forward. So that's all for now. We'll see you next Tuesday. Thanks, Dr. Lancaster. Appreciate you being with us today.
Thank you for having me.
All right. Bye-bye.